Very common question to a pediatrician is, my child is playing a sport, football or baseball, and occasionally gets some chest pain and is referred to a cardiologist. But the pediatrician is sure that very few of them are really cardiac. Is that true?
They are really cardiac. Thank goodness most kids don't have heart disease. Okay, but certainly, we have to be aware of red flags of which ones might actually have a heart problem. But, most basically what I'll do is a history on the patient. Just talk to them. When are they getting the pain? How long have they had it? The intensity of the pain. One question that I love to ask them is, when you have the pain, does it hurt more when you move or take a deep breath or when you touch it? And often the answer is, that it does hurt more.
That's referred to musculoskeletal?
Those are the musculoskeletal ones.
Is there any type of chest pain that would make you more suspicious it's cardiac in an adolescent, or if it's something that maybe is only musculoskeletal?
Now, I'm much more concerned, certainly, if they're getting the pain with activity. I suppose if I would say that if they're getting with activity and it does not seem to be musculoskeletal, then I really have to be more concerned. That's the patient where I would certainly, make sure we get a stress test on them.
But sometimes these kids don't have a cardiac problem. It could also be pulmonary. Is that true?
Sometimes, sure. Even pneumonia or asthma. If you just think of it, even an asthmatic who is breathing hard, using those muscles in their chest, they can eventually get pain.
But if someone has been brought to a doctor with chest pain, that should always be checked pretty carefully to make sure there's nothing more serious about it.
Oh, absolutely. If patients come to you and you want to make sure that there are no red flags. Some of the other things that I think you have to think about, what else might give you a chest pain, like something like hypertrophic cardiomyopathy. So if there's any family history...
cardiac myopathy, is that...
Hypertrophic cardiomyopathy.
Okay, and that is caused by a what?
Well, it's not caused. It's something that you can be born with. Or you actually can develop it
from,
later on in life. It might be genetic, but, you might be the only person in your family to have it.
But we hear sometimes like a professional basketball player drops dead in the court and they have a carditis of sorts or myocarditis. What's that all about?
So those are various forms of problems with the muscle of the heart.
Could that virus trigger that off?
So that's one area.
But could a virus?
Absolutely, and even a simple virus. The same virus which might give one child a simple cold may unfortunately give another child an inflammation of their heart, where the heart is not beating well, it's not beating strong enough, it's weak, and it can also put that person at risk for rhythm problems, which can be very deadly in a heart that isn't healthy.
So the body's pretty smart. It gives you good signals. We have to listen to them. Is that correct?
You have to listen, but I must tell you, certainly the time to diagnose myocarditis is one of the hardest diagnoses for anyone to make.
But we should never exclude the word chest pain till we're comfortable in having a good workup. Is that correct?
Absolutely.